you take them now, you optimize them now for what it's going to do for you 30 years from now. Not the way it makes you feel now. Do not get caught up into only the feel good effects. I'm not going to take it if I don't feel it. Understand that what you do now will have a profound effect on you 30 years from now if you will do it daily for the next 30 years. Pregnenolone. Now, I'll use it in older men, and it's, to improve memory and help with neuronal repair. And of course, you use it as you stated in these younger men that have had brain injuries. So tell us your feelings on pregnenolone itself. It's to me, if people are like, I don't want to take any hormones. I don't want to take any hormones. I just want to do my testosterone, or I just, I don't have I'm not financially able to do them all. And I said, which ones can I cut out first? I will typically say, well, if you're going to cut out any hormone and not take it at all, I guess it would be pregnenolone on my list, but I'd recommend that you take them all because we've already talked about it working synergistically with all your other hormones. But if Dave and I had to really throw it out there, the data in humans and randomized control trials is somewhat limited in pregnenolone compared to the others. Although there's plenty of studies out there, which I have, it's just not as robust as our other studies. But I do use it to improve memory and help in neuronal repair. How about you?
Yeah. Completely. And it's kind of like when people ask that question of like, oh, if you could only do 10 exercises for the rest of your life, what would they be? And I'd say, well, why can I only do 10? If they say, oh, if I could only take 3 hormones, what would it be? It's like, why can't you take 5? Like they're not, it's not, and especially like, I don't know about you, but I get them, I get like a morning capsule and a night capsule. So I compound them together so that way, we can do whatever we can to make it easier and more economical for people. But yeah, I mean, I guess if I had an older gentleman who was like, what's one hormone I could cut out if for some reason I couldn't, I mean, yeah, I'd probably pregnenolone if I had to, but
Right.
I wouldn't. But yeah, so when it comes to pregnenolone exerts a lot of its effects in the body via conversion to progesterone and allopregnenolone, and these are where it has its calming effect. So it's what's called a GABA A receptor positive allosteric modulator, which is a fancy term for making the GABA A receptor more sensitive, which is the same mechanism of action as benzodiazepines, Valium, Xanax, etc. So when someone is deficient in pregnenolone, what pregnenolone also does in the brain is it is very neuroprotective. So anytime someone takes anything that's intoxicating, whether it's caffeine or amphetamine or alcohol or whatever it is, the brain increases pregnenolone release to basically prevent your brain from getting too overexcited and going into an oxidative stress state. So it's like a thermostat. And it seems to have, as well as DHEA, have a lot of these thermostat properties throughout the body. It works on the endocannabinoid system. So a lot of these benefits that we see from cannabis are happening on the CB1 and CB2 receptors, which pregnenolone also binds with. It's technically a cannabinoid. So it's got like your own endogenous version of CBD almost as well.
That's why you see it being used in a lot of these substance abuse disorders in the study. Absolutely, Dave, dead on.
And I often find that people who are pregnenolone deficient will self-medicate with CBD because it works on a lot of the same pathways. So pregnenolone is very much, I like to call it the brakes. I do find that when people are deficient in pregnenolone, when you combine pregnenolone and melatonin, they sleep like a baby. It seems to massively reduce the baseline level of stress in the body, and sometimes this stress can be perceived mentally as anxiety. If you're constantly mentally feeling like there's something wrong, maybe there is, and maybe it's inside, and maybe you're reacting to that. It's like a crying baby. It's saying problem, problem, problem. You don't know what it is. So when I see younger guys who've got brain injuries when they've got pregnenolone deficiencies, the main thing that you see pop up is anxiety and insomnia and being what I call wired and tired. It's like being full of beans in a bad way. It's like the bad part of having too much caffeine. And the thing that I see, like when I reference this gentleman who I spoke about the other day, who I referred to yourself, is that he had all these symptoms of, low testosterone, which is low hormones at the age of 60. And the main thing that didn't improve was the brain fog and the ability to articulate, the ability to actually get the words out that you're wanting to articulate. And I always stutter on this point, ironically, but it's when you're actually trying to articulate what's on your mind and when you're able to speak with good fluidity and speak well and confidently and, not stammer over your words or lose your tongue. And I think pregnenolone makes your brain work better. It's a very powerful neurosteroid, and it's very protective against cognitive decline. And it's also, like, as you mentioned before, insulin resistance is, when I said those 4 diseases of aging, they're all insulin resistance at foundation. Absolutely. And dementia is type 3 diabetes. So I think that when I look mechanistically, pregnenolone and DHEA are very important for energy metabolism in the brain, which you can cognitively feel, but it's also going to be the thing that's going to protect you when you get older. And that's what I think is very important is people want to get to 70, 80 years old. Everyone's talking about longevity. It's like, but you want to actually be doing well when you get there. You don't want to spend the last 20 years of your life, not being able to clean up after yourself. You want to actually be sharp and present and functional. And that's what pregnenolone, DHEA, especially together, are going to be able to facilitate for you. It's just pregnenolone to the brakes, and DHEA is more like the accelerator.
Everyone, please listen to what Dave's saying. I wish they could make a reel on what he just said, which they will, I'm sure. In that, look, you take them now, you optimize them now for what it's going to do for you 30 years from now. Not the way it makes you feel now. Do not get caught up into only the feel-good effects. I'm not going to take it if I don't feel it. Understand that what you do now will have a profound effect on you 30 years from now if you will do it daily for the next 30 years. It is it's so hard to get people to understand that and do it. They'll start for a while, and then people get complacent and they just stop. And once again, they'll just start looking for an easy button somewhere. But there is not one. There is not one. But for me and you, taking hormones is just so easy. It's as easy as brushing our teeth. It's just as easy. So please, it is about prevention, and do not wait until you get symptoms of a deficiency. Do not wait until you get a disease or disorder to start treating it, because that's how we're trained in medicine. We're trained to treat you once you get the disease. You're trained to go to the doctor once you get sick of the disease. We're trying to prevent you getting that age-related disease. We're trying to prevent insulin resistance. We're trying to reverse insulin resistance. So please listen to everything that Dave just said.